Class, hello, and welcome to this Principles for Business Administration session on health and safety. I will be your tutor, Big Owl. Today, we're going to look at the Health and Safety Act, your responsibilities for health and safety. First, let's take a look at what the health and safety legislation says. Under the Health and Safety Act 1974, all employees must take reasonable care of their own health and safety, for example by obeying rules. Take reasonable care for their health and safety of others who may be affected by their activities or actions. Cooperate with their employer or anyone acting on his or her behalf to meet health and safety requirements. All employers must ensure the health, safety and welfare at work of their employees as far as is reasonably practicable. Specific aspects include safe entry and exit routes such as emergency exits not blocked, a safe working environment and adequate welfare facilities such as ventilation, toilets and drinking water, well-maintained safe equipment, for example safe wiring, safe storage and transport of articles and substances, provision of protective clothing, information on health and safety, instruction, training and supervision. Undertake the preparation and continual updating of written statements on the health and safety policy of the company where there are 5 or more employees. This must also be circulated to all employees. Allow for the appointment of safety representatives selected by a recognized trade union. Safety representatives must be allowed to investigate accidents or potential hazards, follow up employee complaints, and have paid time off to carry out their duties. Is there a specific person responsible for health and safety issues? In all organizations, you will find a person responsible for health and safety in your workplace. When you first start your job, you should familiarize yourself with who this person may be. The person responsible could be a health and safety officer or a health and safety representative. As you are required to cooperate with your employer to meet health and safety arrangements, then you need to know who to report health and safety matters to. You need to know how to contact them, whether it is best to send email, memo, or report to them face-to-face should the matter be urgent. It is important to find out if you should be reporting directly to the health and safety officer or if your first point of contact should be your line manager or supervisor. Most organizations have a procedure to deal with or report risks. Do you know what yours is? Some organizations have a fire officer. Their duties may include making sure that fire exits are not blocked, regularly testing the fire alarm, and to ensure everyone is aware of what procedure to follow in the event of a fire. Your organization may have an appointed first aider or a qualified first aider. These persons should be your first point of call should you or another person need medical assistance. An appointed first aider must not administer first aid. Their duties may include ensuring the first aid box is adequately stocked and calling for the emergency services. There should be one qualified first aider for every 50 employees. In some cases, there are more. How are risks managed? Under the Health and Safety at Work Act 1974, it is your responsibility to deal with or report risks. After an organization has undertaken a risk assessment, then all risks in a workplace should be low. However, this does not mean that the level of risk will never change. If equipment develops a fault, if it is moved, if new ways of working are introduced, or anything else occurs that could affect the situation, then the risk level can increase. If this happens, then you may need to report the matter immediately or simply put it right yourself by taking the appropriate action. You are more likely to be able to do this if the risk relates just to yourself or your own working area. For example, the way your own desk or workstation is set out, especially if you use a computer. The way you sit at your computer and the way your chair is adjusted. The way you use equipment and materials on a day-to-day basis. For example, if you type whilst you are talking on the phone by wedging the phone in your neck, this can cause serious neck injury. If there are breakages or spillages in your own area, or untidy habits which create hazards. If you spot a hazard in your own area, such as a pile of files that could fall over, a trailing wire, a broken chair, or a desk drawer left open. If someone else is working unsafely, such as leaving obstructions in a traffic route or propelling themselves along the floor on the casters of their chair. Hazards you would be expected to report include problems or faults with the equipment you use, maintenance problems, for example, loose carpet tile, a damaged plug, or broken blind. Building problems such as a broken pane of glass, slippery steps because of ice, or a jammed door. Consistent or serious unsafe working practices or disregard of safety instructions by another member of staff. In this case, of course, you should see your supervisor rather than anyone else. It is extremely important to immediately report risks that you are not able to deal with. This way, they can be dealt with by the responsible person as soon as possible, thus preventing anyone from immediate harm. To summarize what we have learned today, we have discussed the Health and Safety Act, management of risk, the responsibilities of employees and employers for health and safety. Goodbye, class, and good luck!